Welcome back, everybody. Our doctors are answering your email questions. You can email them to greatdayhouston@khou.com. If you've had problems getting pregnant, then you know the process can be full of setbacks and heartache. Now there's a unique clinic in Houston that takes a holistic approach to fertility issues, and it's amazing what they can predict even before you get pregnant. Please welcome Dr. Michael Allon back to the show with the Center for Women's Medicine and Fertility. Also joining us is his patient, Perla Regalado. Hi there. Now, Perla, you've got that pillow in front of you, but what we can see is that you are actually pregnant.
Yes.
And this is something that is a miracle to you because you weren't so sure this was ever going to happen.
Right. We've tried for 6 years to conceive, and with no luck, of course, before Dr. Allon, I've seen 4 other doctors.
And what did they tell you?
Right away, they diagnosed me with PCOS. The first doctor started me with Clomid. After a few months, we gave up on that and looked for another one. Of course, I was only 22 at the time.
So at least you had age on your side, and Dr. Allon, that is a good thing. But when she said PCOS, that's something that very few doctors really deal with. But explain what that is and how it can stop someone from conceiving.
Polycystic ovarian syndrome is actually the most common endocrine abnormality. It's up to 10% of women, and all women make the male hormone called testosterone. Some women make a little bit more male hormone, and what happens when you make a little bit more male hormone, it prevents you from ovulating. Okay. And by preventing ovulation, there are several eggs that accumulate in the ovary, and that more than 12 on each side. That's called poly, means many cystic ovaries. They're not really cysts, they're where the eggs are located, except there are too many of them.
Yeah. All right. When you say you treat people holistically, what does that mean?
Well, we try to do, obviously, the most advanced treatment we can, but at the same time, there's a well-known link between diet and weight and ovulation, particularly women with PCOS, because what typically happens is they typically produce excess amount of insulin when they ever eat a carbohydrate meal. So what we try to do is try to help them lower their insulin with medication and with diet. Yeah. And we give them a lot of nutritional instructions and help them prepare them for a better chance to get pregnant.
And not only treating you, but also your husband.
Right.
So what things did he take part in?
Actually, other doctors have tested him also, but never did they give anything to him. He didn't need anything, but just for a push, they also prescribed him doxycycline.
Yeah, doxycycline, an antibiotic, and also we have some vitamins that have antioxidants and an herb that kind of help decrease the damage to the sperm right prior to it being released, and it improves its function.
Now, one of the major innovative things that you all are doing as well is that before a woman even gets pregnant, you can predict all kinds of things to make sure that that is going to be the healthiest baby possible.
Yeah, we have a pre-implantation and genetic diagnosis. We can actually, after we do in vitro fertilization, we take the egg and the sperm and it produces an embryo, and we grow it outside for 3 days. And at the 3rd day, it produces 8 cells. So we can take 1 out of the 8 cells, and actually within a few hours in our facility, we can test and diagnose it for chromosomal abnormalities.
Yeah. All right. So you tried this out, and you did get pregnant, but there was a miscarriage?
Yes. In March, the very first IVF we tried with Dr. Allon, I got pregnant and had a miscarriage at 3 weeks.
Yeah, that's a very tough thing. I went through one of those too, and you just kind of want to put it out of your mind and say, okay, I give up. Did you want to give up at that point?
Oh, yeah. Actually, I was kind of iffy about it because, well, I've never gotten pregnant before, and on his first attempt, he accomplished that.
Right, so you had made a lot of, you closed a lot of ground there. All right, so, and that's a very important thing for a lot of women trying to get pregnant. Just to get pregnant is a major milestone. Right. You convinced her to try again.
Yeah, actually, when she came to me, she had 2 other in vitro fertilization in Dallas. And based on the results, the embryos didn't actually grow very well. It was very discouraging to me, but I felt that if we can prepare her very well, and prior to in vitro fertilization and the fact that she did conceive, I encourage her to continue.
Right, right.
Every month there's what we call women cycle-to-cycle variability. A woman can do something totally different in a different month.
Right. And backing up a little bit to what you can tell genetically, what you can tell about that embryo, you can save someone from future heartache, because if something's terribly wrong, you can say, let's just not implant.
Yeah, particularly if a couple had previous miscarriages or they have known chromosomal abnormalities, and then we can determine we can detect Down syndrome and things like that. So that way they don't have the dilemma: what do I do if I do find if Down
Right.
syndrome? Some patients do not want to induce abortion,
Right.
and that's very difficult.
Yeah, but that's the reason why before they even get pregnant,
Right.
you can figure that out. All right, so you get the news again that you're pregnant again, and so that's just you kind of with some trepidation. You're happy, but then you can be a little worried. Now, are you past that point now? Are you okay now?
I'm okay. I still can't believe it.
Yeah.
I don't think it'll be real to me until I have the baby in my arms.
Yeah.
But I'm happy.
It's a boy.
I'm having a little boy.
All right, congratulations to
Thank
you.
you.
Dr. Allon, thank you very,
Thank you.
very
Thank you
much,
so
and letting
much.
us know about some of these just kind of really innovative things that most people aren't doing. It's amazing, amazing. Thank you. Dr. Allon is giving a free fertility lecture. It is Saturday, October 17th from 10 to noon at St. Luke's Hospital, and the first 50 people to call the Center for Women's Medicine and Fertility will get a free consultation if you mention Great Day Houston. Their number is 713-467-4488, 713-467-4488. You can also go to infertilityanswers.com, infertilityanswers.com. Up next, the personal impact of hearing loss and how to correct it.